We also, during a session, discussed the use of oncolytic viruses and how we can use these to activate the immune system and really try to have an auto-vaccination for patients. We know that traditionally vaccines for melanoma have not worked well. And I think part of that is that we don't really know which antigens that are important to try to activate the immune system. Now we're changing that a little bit with oncolytic viruses. So these are viruses that we inject directly into the tumor. And these viruses often are engineered to only replicate in tumor cells and not in normal cells. So that provides a safety factor for patients. When we inject these viruses, then they get into the tumor, they replicate only in the tumor cells. That leads to lysis of the cell and exposure of tumor-associated antigens to the immune system. The immune system then comes in and attacks the melanoma both at the injection site, but also develops a memory to attack the melanoma at distant non-injected sites. And really what this does, this really gives an agnostic way for the immune system, or really to pick and choose the antigens that are important to develop immunity against. So we aren't choosing this for the immune system, but we're allowing the immune system to do this. And does this work? Yes, we presented yesterday data showing that when we inject this locally, there is a very robust activation of the immune system, but also there's an activation of the immune system systemically in the patient's body, and we can detect that in the bloodstream, specifically looking at CD8 positive T cells. We can then look at those T cells and see which antigens that they are reacting against, and we find that those are melanoma antigens. So I think this is a newer mechanism for which we can try to activate the immune system, really to have an auto-vaccination for patients against their own melanoma. So one question that we often have is that which antigens are the ones that the immune system is activating against? So to evaluate this, we really want to look at the T cell receptors. And that has been quite challenging, but we are now doing studies where we are specifically looking at those T cell receptors and then ask the question, if we know exactly which T cell receptors that are activated, can we then take those T cells and augment them ex vivo with then a plan to transfer them back into the patient to try to have a better response. So these are studies and planned studies that are over the next few years will come to fruition.